Yeah. So thank you so much to the VCare team for having me for this talk. And if you see the name says care, they've very carefully selected a set of talks for this session, where Dr. Julka talked about the past and Dr. Pramila talked about the future. I'm going to talk to you about the present, right? So I think this is perhaps you need to be present at this session, right? Okay, so we're going to talk about managing type 2 diabetes beyond medications. So, we all believe this, and this is a lot of what I'm going to talk about is continuation of what you learned in the last two talks. But one thing we learned is that we all may take different routes, but our destination remains the same, right? And this is a nice poem by Longfellow. In life journey on different roads, each with a different twists and turns, yet our paths diverge far and wide. We all seek the same life's end. So let us walk our paths with grace and might, making the most of every day and night. And let us keep our mind as we roam, that in the end, we all make it home, right? So all our patients, need to make it home, right? A home may be different for different people. Maybe for some people, the goal may be primary and secondary prevention of diabetes-related complication, and that should be the goal otherwise. And in some people, we try to target an HbA1c of less than 7, perhaps as a proxy of 0.1, which is trying to prevent the diabetes-related complication. So we are going to talk about a lot of things, but remember, our end goal remains the same, and that is to free our patients from diabetes-related complications, and that's the goal. So have we reached home yet? So my kids always ask me when we are on road, right? Have we reached there yet? Well, that's what our patients also ask me every time, have I reached there yet, right? You say every time, you say, we'll change the dose of your medication. Have I reached a point where you can say that, you're proud of me for my diabetes control? So have we reached there yet? And that's the question we all ask. The reality, unfortunately, at a community level is not so good. So this is a slide shared to me by Fitterfly, where they're, in their data set, shown that people with type 2 diabetes, there are 38% of people in India with type 2 diabetes who have age groups between 31 to 45. This is the working class. This is the breadwinners of the country. These are the people who run the economy, right? And of them, 38% are having diabetes, right? So this is, rather, of all the diabetics, this is the group which often, seeks out medical care. On an average, and if you take the data, the average HbA1c of patients with type 2 diabetes is 8.9%. It's not something we should be proud of. However, the global average is 8.2%, so we are just about, below above that, but we're not that great. And there are 5% of people who are having type 2 diabetes below the age of 30 years. And I'm sure all of us in this room would have seen at least one patient in their teens with type 2 diabetes, right? So that's the reality. We are facing this reality, and we are not home yet, for sure. Again, if you see the data from Fitterfly, if you see the overall profile of how these patients are managed, 73% of the patients are on oral anti-diabetic drugs, right? So that's why this talk is important. What can we do for for these 73% patients, and also for the other patients? What are the other options as well beyond oral antidiabetics? Because our default setting is always, when a patient comes to us with type 2 diabetes, we initiate them on one oral antidiabetic or the other, which is absolutely what we should do. But the point is, what can we do to kind of add on to that and make their lives better? So again, we know that diabetes has a strong link with type 2 diabetes, and obesity has a strong link with type 2 diabetes. And if you take about overall the population, there are 58% of patients with type 2 diabetes who have BMI between 25 to 30. Now here I'm talking about an affluent class of people, mainly urban dwellers. But again, we all see these type of patients in our practice. And then 31% of our patients with type 2 diabetes have a BMI of more than 30, which is also equally concerning. So we are now dealing with, as we say, two epidemics. One is, of course, diabetes, but also the epidemic of obesity, which has its own connotations beyond diabetes as well. And of course, diabetes doesn't come alone, right? Problem often comes in plenty. You often have associated hypertension and dyslipidemia, comorbidities. Some patients have hypothyroidism, GI issues, fatty liver, other diabetic complications. Women may have PCOS, and so on and so forth, right? So you have a lot of complications. And remember, you're talking about these people being in the young age group, where they're already having these complications to deal with. Again, a lot of these patients are newly diagnosed to have diabetes, right? And if you take the data set, 20% of the patients who presented to this company had diabetes for less than 1 year. And again, overall, these, if you see, 70% had it less than a decade. So again, a lot of patients with newly diagnosed often come to us seeking help. So how do we reach our goal? Remember, I take you back to our target. Remember, our target is to prevent diabetes-related complications. That's the main target. We should not get our eyes off the target. That's the target, right? Now, how can we reach there? Of course, lifestyle measures alone could help. In some patients, you have lifestyle measures with oral anti-diabetic drugs, which could help. And of course, lifestyle measures with oral anti-diabetics with insulin is also something which is an option. But the biggest challenge, and I think, thankfully we are a very quiet room today, but generally the biggest challenge for all our patients with diabetes is the amount of background noise that they have to face whenever they are diagnosed to have diabetes. Let me tell you, every day I see 1 or 2 patients who are doing reasonably well, who have reached home, who have reached the target of HbA1c of less than 7%. They often come back and say that I went to a wedding and a relative of mine said that ये क्या दवाई ले रहे हैं, ये सब क्या दवाई ले रहे हैं, ये insulin क्यों ले रहे हैं, right? So, there are always detractors, there are always people who will take your patients off target. There'll be a lot of, social media advertising. Right now, social media has made it free for all, right? You can advertise anything you want on social media and get away with it, right? So, one of the biggest challenges in the earlier era was lack of information, right? For example, you had a chance meeting between somebody from Denmark and somebody from the US talking about some discovery in Canada for insulin to really come into forthlight. In today's world, it would be tweeted by Banting in the first go, right? And would have been retweeted by Best and probably, McLeod. And everybody, someone in Andheri would have heard about it, right? Within seconds. But, now we are in the era of information overload, where these people are, led with excess of information, where often, you have to try to, remove the excess noise and bring them back to the forefront. So what can we do for patients other than oral anti-diabetic drugs? So one, there are 2 things you can do. One, of course, you can do better lifestyle measures, and perhaps timely initiation of insulin in some of these patients could be helpful, right? So these are 2 options beyond oral anti-diabetic drugs. So both of them can help. So let's first talk about the lifestyle measures, right? Now, remember, when we talk about lifestyle measures or when you talk about any typical diabetes clinic, it's always a dietitian or a nutritionist, which is part of the thing. But, like a child who needs a village to grow, a patient with diabetes needs a team to know, right? How to improve their lifestyle measures and stay on the path to wellness each and every day. So it's not just a dietitian which is required. You need a team to help a patient with diabetes, because diabetes is not just about diet. It is beyond that, right? So what you need in reality is a lifestyle measure Avenger squad. You need, of course, a doctor. You need a dietitian or a nutritionist. You need a physiotherapist, perhaps a psychologist, and most importantly, family support, right? You need their patient's family to really help them. So there are 2 key aspects which we should try and understand when we go ahead in terms of, lifestyle measures diabetes management. We are not in the world where we can get away with just, patronizing our patients and telling them what to do. The world has moved towards coaching and not consulting, right? We need to be coaches and not consultants. And secondly, our patients what they want from us is personalization, right? They come to a doctor because they want personalized care. So what is the difference between a coaching and a consulting, right? There's a huge difference. There's the same difference between, what's the difference between a teacher and a coach, right? Now, to give you a difference, all of our children, a lot of you would have children at the age who go to coaching classes, right? Coaching, we have all been through that, and I've been through that, right? We have all been to coaching classes, right? What is coaching? Coaching is something beyond just telling you. In a school, a teacher will tell you what to do, but a coach would help you learn that, reinforce that, check again and go back, right? So again, we need to move to an era, right? We are, teachers are equivalent to, doctors are equivalent to teachers, right? But we need to be more than teachers, we need to be coaches. And that is what is really going to help us. And the second very important aspect, and we talked about personalized medicine in the last talk, we need to really try to inculcate the aspect of personalization, not only for oral anti-diabetic drugs, like we talked about in precision medicine, but also for lifestyle measures, right? Somebody who is motivated to work harder in terms of lifestyle, in terms of exercise, should be encouraged to do that, right? Not discouraged, right? So we need to talk about personalization in terms of lifestyle measures also. So we need to move away from standard lifestyle measures to lifestyle measures which can be backed with digital therapeutics and can be backed by other things, right? So one company which helps you do that is Fitterfly. I have no financial, connections with them, but I have good friendship with them. So I think something goes beyond financial relations. So, this is their process flow, which is very interesting, right? And this is a concept, this is an idea which probably, would be the standard of care in future as well. So what they do is they collect the data, they analyze the data, they identify the issues which the patient has, and then they start taking corrective measures in terms of, diet modification, exercise, stress counseling, and medications. Also, and what is very impressive about this company is that they put mental well-being also in the forefront, right? Like I said, psychologist is equally important. I think that's where, coaches come into picture, right? A good coach really puts the mental wellness of their client in the center of stage of everything. And trust me, nothing helps more than that, right? It really does. We talk about physical fitness, right? There is a focus on how to improve the physical fitness, but not only in terms of, jaake walking karo, but what kind of physical fitness they can incorporate in their life. And of course, then we talk about therapeutic interventions, personalized therapy, personalized coaching, digital interventions, and so on. And, all these things obviously will, lead to good results. So this group has shown 1.6% reduction of HbA1c in 85% of the patient, which is quite impressive, right? Okay. But while I talk about digital therapeutics, right, and while we talk about, companies and startups talking about diabetes in the social media space, there's a big word of caution, really, I'd like to, and we already touched this topic a little bit in both the earlier talks, but let me put my point here and let me put it firmly here. There's, again, a lot of noise about diabetes, quote unquote, reversal. First of all, the correct terminology, and I expect all of us to use that and not use the term diabetes reversal, is type 2 diabetes remission. So first and foremost, our patients, a type 1 patient does not know that he has type 1, type 2 patient doesn't know that they have type 2. When we talk about diabetes, a type 1 starts imagining the future where they are free from insulin, whereas a type 2 diabetes, imagine something else, we don't know, right? So when you're talking about diabetes reversal, talk about type 2 diabetes remission and not diabetes per se, right? Diabetes is a big thing. It could include, of course, now perhaps diabetes insipidus also, who knows. But the point is, be very specific of what you're talking about. While diabetes remission is true in theory, and we already saw in the earlier talk, in practice, long-term diabetes remission in Indian patients, and this is the reality, it's a hard, cold truth, which I'm telling you, is a pipe dream. Trust me, it is very difficult for our set of patients, and there are very reasons, all of us know why. So while a lot of these companies promote this, aspect, they promote the wrong idea. They promote the idea of freedom from medicines. And that, again, let me tell you, let me reinforce, is not the goal. The goal of good diabetes management is not freedom from medicines. It is freedom from diabetes-related complications. And I think any company which does this, they have my, support. But anything which says that we give you freedom from medicine, I'm sorry, right? Please look elsewhere, right? So let us not focus away from the goal. And remember, the goal is not freedom from medicines. The goal of diabetes management is not freedom from medicines. The goal of diabetes management is freedom from diabetes-related complications. And that is the most important thing we should understand. Then, of course, let's look at the other end of the spectrum. So we talked about, apart from oral antidiabetics, what you can do. You can do lifestyle measures. On the other hand, you have the option of insulin also. Remember, insulin was discovered at that point of time. We had no idea whether it was type 1 or type 2. Now we have an idea, and it's useful for both the group of patients. So when do you start insulin, right? So Dr. Julka talked about 100 years of insulin, and in memory of 100 years of insulin, exactly at 100 years of insulin, we created an app called Centurion Insulin app. The idea of this app is basically to help physicians know which patient should be started on insulin. Because, there are many reasons why physicians don't start patients on insulin, but I don't want lack of information to be one of those reasons, right? It cannot be that. I mean, next time I don't want a physician to come and tell me that हमें नहीं पता था कि इस पे insulin की ज़रूरत थी, right? That should not be there. So that's the reason for making this app, right? So when should you start a patient with diabetes on insulin? Obviously, a type 1 diabetes needs insulin. Any patient could be a ketosis-prone type 2 also requires insulin. Diabetes in pregnancy requires insulin. Pancreatic diabetes requires insulin. Perioperative patients, in-hospital patients, patients with complications of renal kidney involvement also need insulin. We all know this, right? Let me not get into too much details of this. Let me show you what we have done to solve this problem, right? So what we did, and like I said, I don't want information gap to be an issue. So made this app, right? it's a simple app, right? So go and download this. You put in the patient's information. You put in the patient's data, the age of the patient, HbA1c of the patient, right? Let's say this patient has an HbA1c of 13.4, right? Fasting blood sugar is 400. I'm sure all of you will agree that this patient needs insulin, but I'm just to kind of try it out, right? It has more nuanced ideas also. The patient is not on oral antidiabetics. You tick all these parameters. Go to the next thing, right? And then there are certain, regulatory things we just have to go through. You confirm that the patient is having type 2 diabetes and not type 1, right? You confirm that it's an adult patient, not a pregnant patient, and so on and so forth, right? So you do all this. You update the patient details, and it'll tell you, whether your patient needs insulin or not. Now, what we have done is basically distilled the, guidelines about insulin initiation in patients with type 2 diabetes and said, so this patient Mr. DP or Mrs. DP requires insulin, right? That's what this app tells you. So again, this solves the issue of a patient coming to me next time and saying that, a doctor coming and sending a patient saying that we didn't know that this patient required insulin, right? So that's the idea of initiating, having this app. Now, one purpose of this app, and, I'll go back to the talk from Dr. Julka. When I heard one of the things he said, like I said, there'll be some bell ringing in your, brain, or some light bulb, and so eureka moment. For me, that eureka moment is that when insulin was discovered, it was given free of cost, perhaps for a rupee, or you can say, and somebody else took it up and developed upon it, right? This has been done in today's world and what is known as open sourcing, right? If you see any developments these days, if you take about ChatGPT, right, it's in vogue a lot these days. It's an open source application. Somebody has developed a part of it and then kept it open for the rest of the public to develop more upon it, right? So that's how the world is moving towards. And what we have developed is a free software, right, which is open source. So if anybody wants to develop beyond it, right, please feel free to develop more about it and maybe have more applications based on this, right? So again, I'm not going to the guidelines in detail, but this is what American Diabetes Association 2022 guideline says, that you should consider insulin as the first injectable. If a patient has an ongoing catabolism, right, symptoms of hyperglycemia, so your symptomatic hyperglycemia when HbA1c is more than 10, when blood sugars are more than 300, or where possibility of a type 1 diabetes is considered, in such patients you should start insulin, right? Okay, I'll skip the second case in interest of time, right? So let me take you straight to the take-home messages. So my first take-home message for you is, we cannot take our eyes off the target. Remember, the target of every patient is to achieve good glycemic control and to avoid diabetes-related complications. That's the target, right? So that's the most important thing. Lifestyle measures, of course, need to be reimagined, right? We need to move away from saying that, look, this is the diet chart. What exercise are you doing? I'm walking fine, right? We need to move beyond that. It takes a team effort to do this. It's not something we can do alone. We require coaching and not consulting, and we require personalization to achieve this goal. Of course, we cannot do it at individual stages, so we could take help of digital therapeutics, which could help us to do this. And of course, Fitterfly is one company which is doing well. And then, of course, on the other end of the spectrum, we often have delay and inertia in initiating insulin. So timely initiation of insulin is extremely important in patients with type 2 diabetes. And the app we have developed, like Centurion Insulin app, can help us achieve this goal for starting insulin at the right time in the right patient. And most importantly, and this is the most important take-home message, right? We hear a lot of background noise. We hear a lot of talk about this. Let us not forget that goal of diabetes treatment is not freedom from medicines or freedom from insulin. It is freedom from diabetes-related complications. That's the aim. It does not matter how we reach this goal. We need to reach this goal. That's the target, right? Thank you.